Hope you're all having a great day so far. Welcome to episode 10 of my second season. Today is Wednesday, March 10th, 2021. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, I know we've rolled out 3 amazing vaccines to date, but let's remember the over 500,000 lives lost in our nation to date as well. And continue knowing our incredible frontline heroes and heroines are still out there, superhero capes, PPE and all, fighting and fighting for all of us to heal and get out and stay out of their hospitals. So let's continue doing our part, keep masking up, washing up, and staying physically distant. Now, are you concerned about all the new audits that may soon flood your practices? Well, look no more. I have details in this episode. This episode also highlights the OIG Work Plan for February 2021. I also deliver my trusty tips on the SMRC, or Supplemental Medical Review Contractor audits that are in full swing. And I share some inspirational words from our 26th president, Theodore Roosevelt. If you've checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help your providers paint the medical picture. If you like what you're hearing, go ahead and hit that subscribe button now so you don't miss an episode. Please write in a review and 5-star rating on Apple Podcast or wherever you listen to my podcast. I'd really love your support. Now, a quick disclaimer. Before I get started on the episode, this podcast episode and Nexsen Pruet podcast series do not constitute legal advice, but I am fortunate to work with sound healthcare attorneys at Nexsen Pruet. And as their consultant, I have over 10 years of experience in front office, back end, coding, and billing for multi-specialty physicians, compliance, and auditing for both E&M and surgical operative reports. Again, the opinions and insights throughout are mine alone, and they in no means constitute legal advice. So, let's get into Newsworthy. I wanted to go over the 7 new February 2021 updates made to the OIG Work Plan. The first is titled Audit of Home Health Services Provided as Telehealth during the COVID-19 Public Health Emergency. It's being conducted through the Office of Audit Services. Now, let's remember way back on March 13th, 2020, the 45th president declared a national emergency in response to the COVID-19 pandemic, which allowed the Centers for Medicare and Medicaid Services, CMS, to take proactive steps to support the response to COVID-19 through the use of Section 1135 waivers. With this authority, CMS waived certain requirements in order to expand Medicare telehealth benefits to our healthcare professionals who were previously ineligible, including physical therapists, occupational therapists, speech-language pathologists, and others. However, the waiver does not allow for payment of telehealth services on home health claims. But in the COVID-19 Public Health Emergency Interim Final Rule with comment, CMS amended regulations on an interim basis to in fact allow home health agencies to use telecommunication systems in conjunction with in-person visits. Further, the calendar year 2021 Home Health Prospective Payment System, the PPS Final Rule, CMS permanently finalized these changes. The final amended regulations state that the plan of care, the POC, must include any provision of remote patient monitoring or other services furnished via telecommunications technology or audio-only technology, and that such services must be tied to patient-specific needs as identified in the comprehensive assessment. The regulations further state that telehealth services cannot substitute for a home visit ordered as part of the plan of care and cannot be considered a home visit for the purposes of patient eligibility or payment. The OIG will evaluate home health services provided by agencies during the COVID-19 public health emergency to determine which types of skilled services were furnished via telehealth and whether those services were administered and billed in accordance with Medicare requirements. The OIG will report as overpayments any services that were improperly billed. They will then also make appropriate recommendations to CMS based on the results of their review. The final report is expected in fiscal year 2022. Now, the second update to the February 2021 OIG Work Plan is titled Use of Telehealth to Provide Behavioral Health Services in Medicaid Managed Care. This report is being conducted through the Office of Evaluation and Inspections. Now, states have significant flexibilities to provide telehealth services, and all 50 states, including the District of Columbia, currently provide some Medicaid coverage of telehealth. However, limited information is available about how states use telehealth to provide behavioral health services to Medicaid enrollees. So, this review will describe three things. The first, the challenges that states face using telehealth to provide behavioral health services to Medicaid enrollees. The second is the extent to which states assess the effects of telehealth on access, on cost, and on quality, and they'll monitor telehealth to provide behavioral health services. And third, how states use telehealth to provide behavioral health services in Medicaid managed care. The OIG has been collecting data for these products prior to states' expansion of telehealth in response to the COVID-19 pandemic. However, this information will continue on and be valuable in future decisions to strengthen the telehealth possibilities on a more permanent basis. So the OIG will continue on and disclose this audit. The final audit report is expected in fiscal year 2021. Now, the third update for the OIG Work Plan for February 2021 is titled Audits of Medicare Part B Laboratory Services during the COVID-19 Pandemic. This review is coming from the Office of Audit Services. Now, we know laboratory tests are critically important because they are used for early detection, diagnosis, monitoring, and treatment of disease. Laboratory testing for both COVID-19 tests and non-COVID-19 tests is important for all Medicare beneficiaries, but may be especially important for beneficiaries with certain medical conditions who are identified to be at increased risk for severe illness due to COVID-19. So ensuring individuals receive necessary laboratory tests is critical to improving healthcare quality and containing long-term health costs. The OIG's preliminary analysis has shown that the number of non-COVID-19 tests billed for Medicare Part B beneficiaries during the COVID-19 pandemic has decreased compared with the 6-month period before the pandemic, and many independent laboratories have encountered challenges in providing COVID-19 testing. The OIG will conduct a series of audits on Medicare Part B laboratory services during the pandemic that will initially focus on the effect of the pandemic on non-COVID-19 testing. The series of audits will also focus on aberrant billing of COVID-19 testing during the pandemic. This final report is expected in fiscal year 2021. Now, the fourth OIG Work Plan update for February 2021 is titled Audit of HHS's Contracting Compliance for the Acquisition of Information Technology. This review is being conducted from the Office of Audit Services. Now, the U.S. Department of Health and Human Services, HHS, is one of the largest contracting agencies in the federal government. For example, in fiscal year 2020, HHS obligated $3.4 billion to the acquisition of information technology, IT. HHS has one of the largest dollar investments in major IT systems and the second largest number of IT investments in the federal government. The Federal Acquisition Regulation, the FAR, guides the acquisition process by which executive agencies of the federal government acquire goods and services by contract. The OIG will perform a series of 3 audits. For each, the OIG will examine one vendor with contracts awarded for the acquisition of IT exceeding $10 million during fiscal years 2018 through 2020. They will then determine whether each vendor is administering certain IT contracts in accordance with federal statutes, regulations, and HHS policies and procedures. All final reports are expected in fiscal year 2021 and fiscal year 2022. Now, the 5th OIG Work Plan update for February 2021 is titled 2020 Performance Data for the Senior Medicare Patrol Projects. This report is coming by way of the Office of Evaluation and Inspections. This memorandum report presents performance data for the Senior Medicare Patrol, the SMP, projects, which receive grants from the Administration for Community Living, the ACL, to recruit and train retired professionals and other senior citizens to recognize and report instances or patterns of healthcare fraud. OIG has collected these performance data reports since 1997. The final report is expected in 2021. Now, the 6th update to the OIG Work Plan for February 2021 is titled Ensuring Dual Eligible Beneficiaries Access to Drugs under Part D, Mandatory Review. This report is conducted by the Office of Evaluation and Inspections. Now remember, dual eligible beneficiaries are enrolled in Medicaid but qualify for prescription drug coverage under Medicare Part D. So as long as Part D plans meet certain limitations outlined in 42 CFR Section 423.120, Part D plan sponsors have discretion to include different Part D drugs and drug utilization tools in their formularies. The OIG will review the extent to which drug formularies developed by Part D plan sponsors include drugs commonly used by dual eligible beneficiaries as required. The Affordable Care Act in Section 3313 requires OIG to conduct this review annually. So the final report is expected in fiscal year 2021. Now, the 7th OIG Work Plan update for February 2021 is titled Awardee Challenges in Implementing COVID-19 Vaccination Program. This report is coming from the Office of Evaluation and Inspections. Now, dispensing vaccines effectively and efficiently is a critical step in fighting the COVID-19 pandemic. The CDC Immunization and Vaccines for Children Cooperative Agreement, awardees, which are typically state and large metropolitan area public health departments, plan for and oversee the vaccine distribution and administration process. Stakeholders have acknowledged challenges early in Phase 1 distribution and dispensing, and note that these challenges will likely span all 3 phases identified in the CDC's COVID-19 vaccine playbook. The OIG will interview all awardees to identify the reported challenges they are facing while distributing and dispensing vaccines. The OIG will also ask awardees about effective strategies to mitigate those challenges, as well as any new challenges they anticipate, and also how HHS can best support them in distributing and dispensing COVID-19 vaccines. In doing so, this review will provide HHS with timely as well as actionable information to address challenges associated with the COVID-19 vaccination efforts. The final report is expected in fiscal year 2021. Now, in my opinion, I always believe providers and practices need this critical information to review their coding and billing practices or their overarching compliance programs. As you can see, 2 out of the 7 of these work plan items will address the accuracy of telehealth reimbursement during the PHE, from home health services provided to some of our most vulnerable population and to our Part B lab services because of all the confusion and changing guidance very early in the pandemic in the spring of 2020, right? In my opinion, there may likely be a third audit stemming from the review of Office of Evaluation and Inspections for behavioral health services performed as telehealth. Let's wait and see. Now, of course, it's still unclear of the amounts that may be in controversy or how we can successfully navigate the potential overpayments that will be issued. However, now we know all the facts that more audit letters are sure to come. I think these reports with findings are always most interesting and informative, and I always look forward to analyzing them in the years ahead. It's also important for my listeners to keep an eye out on these monthly OIG Work Plan updates to see how they may impact you, your provider, or your health system. Stay tuned for my monthly OIG Work Plan updates. They drop the second Wednesday of each month. And now, it's time for my best practice tips in Trusty Tip. Please don't get too comfortable with the Medicare audits that have been on hold for quite some time since the pandemic slammed into our shores last year. These audits have ramped back up, and I've been seeing them left, right, and center. So let's get into part 1 of SMRC audits. Now, the SMRC is the Supplemental Medical Review Contractor for Noridian. Yes, that's right, that Noridian, with jurisdictions E and F for the Medicare Administrative Contractor, the MACs, for Parts A and B, as well as for Durable Medical Equipment, DME, with jurisdictions A and D. Now, Noridian was awarded the Unified Program Integrity Contractor, the UPIC contract, back in 2018 by CMS. Their function is to conduct nationwide medical reviews of Parts A, Parts B, and DME providers and suppliers as directed by CMS. It's the responsibility of the SMRC to review medical records and related documentation to ensure that claims are processed in accordance with CMS guidelines. Now, as of the date of the new administration taking over, these SMRC audits are already turned back on, so to speak. Hope you're all sitting. There are 17. Yep, that's what I said, 17. A whopping 17 post-payment audits that are known as project review types for fraud, waste, and abuse prevention, program integrity, or provider compliance group analyses. I'll be spotlighting and featuring all of them in detail as the weeks go on. Don't you worry. But today I'll provide a little trusty tip teaser for the first. It's titled 01-011, DME Supplies in Non-Covered Skilled Nursing Facilities Notification of Review. Now, Noridian SMRC is conducting post-payment review of claims for Medicare Durable Medical Equipment, the DME, supplies in non-covered SNF stays, billed on dates of service from January 1st, 2017 through December 31st, 2017. Remember, these are the time parameters involved. This notification includes the reasons for the review, documentation that will be requested in the additional documentation request letter, the ADR, and resources or providers and suppliers who may wish to consult with when submitting claims. Who you may wish to consult with when you're submitting your claims and supporting documentation. Some background on the why. Why on earth is this happening? An OIG report back in 2018 noted that for 72% of the potential inappropriate DME claims, the DME suppliers failed to correctly code the SNF, the skilled nursing facility, as a facility. Instead, DME suppliers coded the place of service, the POS, as the beneficiary's home, their house, thus enabling the claims to bypass the CMS edit that rejects separate payment for most DME provided at facilities. The report also noted that for 98% of the inappropriate DME claims, SNFs did not submit no payment bills, which represent administrative claims that document the dates of non-covered stays and do not result in payment. And then, of course, the reason for the review is listed. And they're narrowing it down in scope, of course, thank goodness. The scope involves the SMRC performing data analysis and review for DME supplier claims for oxygen and oxygen equipment during non-covered stays in SNFs billed with the POS code of home. Noridian will complete data analysis and review activities in accordance with applicable statutory, regulatory, and sub-regulatory guidance. They are honing in on place of service 12 for the patient's home. They're also pinpointing HCPCS codes. For example, they're first looking at HCPCS code E0431 for portable gaseous oxygen system rental. Includes portable container, regulator, flow meter, humidifier, cannula or mask, and tubing. They're also looking at HCPCS code E0443 for portable oxygen contents, gaseous, 1 month supply, which is equal to 1 unit. They move on and want to look at HCPCS code E1390 for oxygen concentrator, single delivery port, capable of delivering 85% or greater oxygen concentration at the prescribed flow rate. They move on and would like to look at HCPCS code E1392 for portable oxygen concentrator rental. And finally, they want to look at HCPCS code K0738 for portable gaseous oxygen system rental, home compressor use to fill portable oxygen cylinders, includes portable containers, regulator, flow meter, humidifier, cannula or mask, and tubing. Now remember, please, if you receive this type of ADR letter, this additional documentation request from the SMRC, you'll have to include a DWO, a detailed written order. Now, I've spoken about a DWO in prior podcast episodes. You'll have to include your WOPD as well, your written order prior to delivery. You'll also have to include your POD, your proof of delivery. I've spoken on this in prior episodes as well. And of course, you'll have to include everything that supports coverage for place of service 12, the patient's home. Remember, these post-payment audits are a sign, a bright neon sign that something may be amiss in your documentation, your coding, and billing. But a better, smarter approach is one that's proactive and starts by painting a clear, rich, and vibrant medical picture the first time, so your certified medical coder can then abstract codes with accuracy. And finally, in this week's inspiring quote in Spark is from our 26th American President, Theodore Roosevelt. Great thoughts speak only to the thoughtful mind, but great actions speak to all mankind. Profound, right? I think this is a tremendous statement on elements that make up greatness. Great ideas hopefully lead to great actions. We can all start by crafting and developing those ideas, make them great. Belief in those ideas with all our intentions aimed at greatness. We can turn those great ideas alive by taking action. Remember, we have our entire lives ahead of us to create and to act. Each chapter in our lives allows room for new ideas, new actions, new chances at greatness. I'm happy Teddy Roosevelt's spark still burns brightly in all of us today. So, that wraps up today's episode. I know that spring break is around the corner for so many of us. Enjoy. But remember to keep masking up, washing up, and staying physically distant. We're not out of the woods yet. Please go out and make this a great day, an incredible week for yourselves. Celebrate all the women in your lives. This is the month of Women's History Month. So celebrate your mothers, your grandmothers, great-grandmothers, nieces, sisters, all your girlfriends. Celebrate them all. So aim a little higher and do more. Give back, give back, give back in 2021. That's my biggest commitment this year. I'm trying to give back more. There's so much each and every one of us can do. As always, I appreciate you diving into today with me. And if you would like to inquire about my consultant services, you can always reach me through my email address at nexsenpruet.com. I'll leave links to everything in the show notes below. Please continue staying safe and healthy, practice safety for one and all during our collective life in the time of coronavirus. Thank you for listening in on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.